Hello, my name is David.Romberger. I'm a graduate student at University of Texas, Arlington. Today I'm going to be doing a YouTube presentation on teaching strategies. The teaching strategy we're going to focus on is concept mapping. The audience is going to be new grad nurses starting at a children's hospital, and their subject matter is cardiac defects. So what is concept mapping? Concept mapping is a teaching strategy that helps students connect their main concept or subject to sub-concepts. It shows relationship, cause, and effect, and it really benefits visual learners as they connect their strategies. The topic, congenital heart disease. We're going to review the types of congenital heart disease and use our concept map to classify. Congenital heart disease is going to be represented by our blue circle and CHD. CHD is a problem of the heart structure or function that is present at birth. It's the most common birth defect, affecting 1% of all live births, and it's also causes more deaths in the first year of life than any other birth defect. It's essential that you know the normal anatomy of the heart and understand the blood flow. The colors representing low oxygenated blood and high oxygenated blood is going to be important as we follow the different blood paths that congenital heart defects have. Blue, low oxygen; red, high oxygen. There are two different types of congenital heart defects: cyanotic and acyanotic. Cyanotic is demonstrated here as the aorta has purple blood flow, indicating lower amount of oxygen, less than 90% saturation. On cyanotic, you have a heart defect, but your aortic or systemic blood flow is normal oxygen content greater than 90%. Types of cyanotic include mixed blood flow and decreased pulmonary blood flow. Acyanotic includes increased pulmonary blood flow and obstruction of blood flow from the ventricles. Let's look at a mixed blood flow defect. Transposition of the great arteries is one. The aorta should normally be coming off the left ventricle, but here it's on the right ventricle. There's a hole between the right atrium and the left atrium. There's mixing of deoxygenated and oxygenated blood, giving you that purple color, and the systemic blood flow is now at a lower oxygen level. Let's look at a defect with decreased pulmonary blood flow. Tetralogy of Fallot is one. It actually is a combination of 4 defects. You have pulmonary stenosis here, a ventricular septal defect, and overriding aorta into the right ventricle. In this defect, you have less blood flow to the lungs, and notice how the aorta has a purple color. Acyanotic, let's look at AV canal. Notice how the aorta has bright red blood flow showing in the systemic, but there's missing a ventricular septum and an atrial septum, and there's mixing and an increase of blood flow to the lungs. Obstructed blood flow. Coarctation is an example of that. Notice how there's normal pathway to the lungs, normal pathway to the body, yet there's a narrowing of the aorta just after the arch, causing obstruction. All right, class, let's start with some questions here. Taylor, would you please tell me what makes a heart lesion cyanotic?
It would be cyanotic because of the decrease in O2 in the aorta, and that's indicated by the purple.
Great, excellent. Tatum, can you define for me a acyanotic heart lesion and how you would tell?
Acyanotic has normal oxygen levels in the aorta, indicated by the red color.
Great, thank you. All right, we're going to use our concept map to categorize some more congenital heart defects. This is one we haven't talked about yet. Total anomalous pulmonary venous return. The pulmonary blood flow, instead of returning to the left atrium, is coming to the superior vena cava. Taylor, can you define for me whether this is cyanotic or acyanotic?
It would be cyanotic.
Great. Notice how the blood in the aorta is purple, indicating a lower saturation. Is it mixed, or is it resulting from decreased pulmonary flow?
That would be mixed blood flow.
Great. We can see at the atrial level, right atrium level here, the oxygenated and deoxygenated is mixing, creating that lower oxygen level. Good answer. All right, let's look at this defect called ASD, or atrial septal defect. There's a hole between the two septums. Let's start with our concept map. Is it cyanotic or acyanotic, Tatum?
It is acyanotic.
Great. Is it resulting in increased pulmonary blood flow or obstruction to the blood flow from the ventricles?
It is increased.
Great. We can see here that there's a left to right shunt as blood comes from the left atrium into the right atrium. More blood is going to the lungs than to the body, but yet the body still has high oxygen content. Good job. Our last heart defect we're going to look at is hypoplastic left heart syndrome. Notice how the left side didn't develop. The LV is little, the RV is the only ventricle functioning in this heart. Taylor, can you classify cyanotic versus acyanotic?
The heart would be cyanotic.
Great, good decision. Is the cyanotic result of mixed blood flow or decreased pulmonary blood flow?
Mixed blood flow.
Good job. Hypoplastic left heart is a cyanotic lesion with mixed blood flow. Notice how at the atrial level, the oxygenated, deoxygenated blood are mixing with the RV giving blood flow to both the lungs and the body. All right, that's going to conclude our class. Good job learning your congenital heart disease and classifying them into groups.